Yeah, we continue straight away. Welcome to our third live Tell Me More About session of this evening. For the next 20 minutes, we're going to dive deeper into the topic of specifically getting started with digital dentistry together with Professor Andre Chen. And remember, like before, we are still live, so make sure you make the most of this late night session by submitting any questions you might have. They will land up right here on my desk. Now, Andre Chen is now joining us live from Portugal. Good evening, Andre. Thank you for being with us. Where exactly are you tonight?
Hello, Garrett. Good evening. I'm at my home in Lisbon, Portugal. Unfortunately, I'm not in Paris, France, for the reasons you all know. But I'm here live with you.
Yeah, it would have been fun to have you here at the desk and be together. Unfortunately, we didn't get the chance, but I'm glad you're still able to join us through the live connection tonight. Now, you are a professor at the University of Lisbon, an oral surgery specialist, and of course you run your own private practice where you know a lot about digital technologies. I can imagine for some of our viewers, all of these new digital technologies can be a bit overwhelming. And we just learned they can also bring some difficulties in establishing new protocols in our daily clinic flow. So in your view, what should be the key objective of digital dentistry and how and where can it support us the most?
Well, Garrett, nice question. But before I get the answer for you, let me take the opportunity to thank the European Academy of Osseointegration for the kind invitation to be here, and a special word for the organizing committee and the scientific committee that put together this amazing meeting in these times of uncertainty. And for that, I applaud, and I'm very thankful to be here, and it's a great honor. And yes, it's a tough question because, you know, if you were here the last 2 days, you heard much about digital technology, and especially today, I've been watching and listening carefully, and I totally support all of those things that were said here. But one of the things to answer to your question is that normally people do me that answer, said, so Andre, what is for you the main key of digital implantology? And I make the same question to them, and in the majority of the answers I get, well, I use digital technology to be fast. Well, I don't necessarily agree with this kind of opinion, because I think, like you heard before, the experts, and you were here, I think digital technology has to come for us to be better. And if we're not better, then forget digital technology. You might just go with the classic protocols that you're much better because you know the outcomes, you know your literature, your evidence-based research. But obviously, fast is almost a secondary outcome of the machinery that you have available. So for me, it's clear that digital technology has to come for you to be better. So when you're getting started with digital technology, like the majority of people that are watching this show are, the main take home that I always said to him is that, okay, you now have a lot of machinery, like the anterior panel was talking about, but you never forget, and I take the last words of Professor Renoir, but you always have to bear in mind that you should know your biology and incorporate digital technology in everything that you know in your classic education, in your implant dentistry education. You have to take that available technology into what you know, and not the other way around. Because when you start to do all those things, you may start to make new mistakes that you were not aware, and that the clinical incorporation of this digital technology becomes harder and harder and harder. So I totally agree that the classic protocols that you have in implant dentistry should be taken in account. Now, this means that we have a lot of work to do. I totally agree with the last 3 speakers that were there. I mean, we have new materials. I mean, you were here Monday, you spoke about ceramic implants. You were here today, you have digital technologies. But don't forget that each step of the way, we have technologies, but we also have to have evidence-based research through all of these new methodologies that we are doing right now. So this slide almost represents what we have in technology and what you spoke about all morning: digital prototyping, CAD/CAM machineries, digital guides, and all of these needs to be researched in order to have clinical valid recommendations. So that's why I completely agree with the last panel. So when you brought it up into an implant, protocol, you see that from A to Z, you can have the incorporation of digital technology into your clinical protocols. So most of the workflows that you have nowadays, you have some sort of machinery or some sort of digital technology that will be used in order to perform your clinical act. So having said that, you also need to have clinical valid research in order to do all these recommendations, to the general practitioner. But one of the key points for me that the most important, and one that we'll probably talk about in the next 20 minutes, is placing the implant accurately. Because when you're getting started with digital implantology, the first thing that you will be tempted to do is within the implant dentistry scope to have a digital guide or a surgical guide that will aid you to place the implant on the correct site. So I think that we have a lot of technology available, but we also need to incorporate our classic knowledge and our classic protocols of digital implantology.
Yeah, good you underline that need for classic education. I hope a lot of education are watching and paying attention. You also showed this covers the entire workflow. And I can assume that this seems an area that moves at the speed of light. On the other hand, we also just heard Frank Renard say that many of these digital tools have been around for quite a while in the dental practice. And now I'd like to quote a philosopher based on my late night show with Henning Schliepacher yesterday. I think it was Confucius who once said, learn from the past if you want to predict the future. What do we need to know about the background of digital dentistry, Andre?
Well, I completely agree with that sentence, both of Confucius and both of Dr. Schliepacher, because, in dentistry, we have a tendency to have a history, then forget it for a while, and then you go back to that cycle again. So with digital technologies, it happened more or less the same. People forget that digital technology wasn't born yesterday or 2 years ago. In fact, it has a history that we could not forget, and we should be aware. Should be aware why? Because the majority of problems that we have now, we also had in the past. So if you look down for the last 20 years, you see that digital evolution is not static, it's not a point in time, but it's actually, a broadened curve that began 20 years ago. Each year that goes by, there's a new introduction of a new sophisticated digital tool that will help you to get to the fully digital workflow. Now, for example, I give you the static guided surgery that we are doing now. Some people forget and are starting digital technology and completely forget that we had this technology for the last 15 years. And we know the mistakes that happened 15 years ago, and we are doing probably the same mistakes now because sometimes we forget about that past. So it's very important that you know where you are in point of history, to know the mistakes that we did in the past and pick up from there in order to solve them. So I didn't know what the last panel was saying, the expert digital panel was saying, but for me, this is very important. For someone who's getting started with digital implantology, for me, digital implantology only comes at the very end. First, you have the human values, the education. Then you have your evidence-based research, your classical knowledge, your implant education. Then you obviously get out of the universities and the postgraduate programs. You start to have your clinical expertise. Then you mount your clinic and you're starting to have the gadgets, like I call the gadgets, the laser, all those gadgets that we know. And only then, when you master all of these things, you can incorporate technology into your workflow. Or otherwise, you are falling in the mistakes that Professor Renard was saying. And for me, it's very important to state that when you start with digital technology, you should be very careful because it's not a world problem-free.
Exactly. So again, underlining the importance of really understanding what we are digitizing. So let's go on that journey and let's get started with digital dentistry. What do you think is the key difference between analogic thinking and digital thinking when it comes to implant dentistry?
Well, that's also a nice question, Garrett, because we've been watching digital technologies, and digital technologies have increasing the broadens of the clinical floor that they act. So we began with treatment plan. With treatment plan was very nice because you have more patient acceptance because you can show patients the treatment plan and patients accept it. But the really problem started when you actually have to treat the patient. When you go to surgery, then protocols are no longer that that funny. You have some mistakes, and then when you go to the prosthodontic part of implant dentistry, you also have some mistakes that you have to be aware. But for me, the key of this interaction, of this digital interaction between the patient and the dentist, was that in the past, if you have a patient that needs an implant therapy, he goes to the dentist, he tells you a problem that he has, and then your communication with the lab technician is always sending information to the lab technician and then getting back that information from lab technician. And sometimes we get lost in translation. So for me, the great advancement in treatment planning on these cases is that you now are sitting side by side with the prosthodontist, the oral surgeon, and the lab technician, giving information to a computer, and then trying to digitalize the patient, trying to get to the virtual patient. And once you get to that virtual patient, then you start, to send all that information to the different, machinery that you need. If you're going to need a surgical guide, you send this to the 3D printed. If you need a CAD/CAM crown, then you send it to the CAD/CAM machine. So the idea is now that all the team is sitting next, side by side, sharing information. And then from a treatment plan point of view, you have a big advantage on this. And obviously, when you open up your digital flux, then you see that you have a lot of things in digital implantology that you have to know the protocols and the evidence-based research behind. So I think that was the main key and the main difference between the analogic and the digital tools.
Exactly. The fact that we all work with the same information, whichever role we have in the treatment planning. That's a great message. Now, when we talk about digital dentistry, the word accuracy keeps popping up. You already mentioned that today as well. Either as a key motivation to go digital, or rather to stay away from it. So what can you say about studies specifically about the outcomes in relation to static guided surgery and the errors that still remain?
Yes, that's a fair question, and we covered that a couple of months ago in the Just Ask session, and it was very funny because I received a lot of messages asking me about the errors, and yes, there are still some errors in digital protocols that we have to be aware, because again, if you're getting started with digital implantology, it doesn't mean that you're now having a surgical guide that will solve all your problems, and we will have problems free. Is like Professor Renward was saying, if you need always the human factor to decide, because this is a medical profession, to decide what's good and what's bad and to solve the mistakes. So when you talk about accuracy of digital protocols, especially in the outcomes of the static computer system guidance, you had already a couple of speakers that mentioned a little bit these errors that there is. But you have to bear in mind two things. One is the evidence-based research that we have on digital protocols and the difficult that it is to have a clinical recommendation. Because digital technology is evolving in a fast pace, like you said. So if you're doing a randomized clinical control trial about an intraoral scanner, and because you know that these clinical trials take a lot of time, sometimes when you have the answer, probably the software is already in the version 4.0 and then becomes difficult to keep track on these technologies. In the past, we didn't have that problem because the digital technologies wouldn't arrive from one year to another. So we had a problem there. But when we are talking about accuracy, you have to think one thing. One thing is to compare digital protocols, special in implant dentistry and surgical guides, against your free hand. Imagine if you don't have a guide and you're comparing this accuracy with your free hand. All the literature, or the majority of the literature, tends to show you that you're much better with a guide, which guide it is, than with the free hand. But obviously, if you're comparing, within the same protocols, what you planned and what you had, then you have some deviations that are important to recognize. You understand that they may be a mistake. So when you're talking about fully digital protocols, like the ones that you are seeing here, you see that along the evidence-based research along the years, the error more or less maintains itself. One would think that, because from 2009, from 2020, you had a lot of new technology that will improve the outcomes. The reality is that from 2009 to 2020, you can see in this slide that the error is still there. You have a deviation from what you plan to what you have in your mouse. Now, again, if your starting baseline point is what you plan, you have an error. But this is much far better than your freehand. So you still have an error on the angle of the implant and on the depth of the implant that can have a clinical impact on the position of your implant, especially depth position, because as you know, some of implants weren't made to be crestal or supracrestal, they were made to be subcrestal. And if you have that kind of problem, it can be a problem for you. So the same error exists not only in fully guided systems, but also in partial, the so-called pilot drilling, meaning that if you only have a guide to pinpoint where is the best prosthodontic position, you still, in the latest systematic reviews from 2017, they clearly show there's also still an error more than the fully guided surgery, it's obvious, but you still have an error. So either if you go pilot drilling or fully guided, you have an error. And the last piece is that we saw, and you had here Dr. Block that talked about this. If you compare the static computer-assisted guidance with the dynamic assistant guidance, one would expect that, because you have now robotics in the way, that it would increase the outcomes. And in fact, when you compare both in the systematic reviews or in the randomized clinical control trial, from the implant deviation of static, there is the above column, to the dynamic guided surgery, you see that even the dynamic guided surgery in the latest reports have some sort of deviation. Now, the curious thing is that the dynamic guided surgery, it seems to have a little extra edge on the dynamic, because you see that the error from different randomized clinical trials from different centers, they almost present the same error. It's more constant, the error. So that goes for accuracy and precision. So it means that, when you're using a dynamic guided surgery, you're more constant in doing your surgery. So there's always an inherent error, because there's always the human hand, and there's always a lot of articles that refer that the surgeon, the skill of the surgeon is still something or somewhat of importance. And all of this technology will not work if the surgeon or the prosthodontist doesn't know what he's doing. So this is the main message that we have from literature.
Exactly. Well, thank you for pointing that out so extensively. Well, Andre, I have to say, last time we talked, we had 90 minutes. Time's flying when we're live on the EAO Digital Days. So if you could wrap up, if there's one thing that you really want us to take away to get started for digital dentistry, you mentioned the importance of conventional education. You mentioned the importance of knowing where you digitize and working together as a team, and the importance of accuracy. What is the one thing that you really want people to do now?
I mean, you have to be aware that, sometimes when you're young, you want to try everything. I know, I was there because, when you start the post-graduation program, you only want to do sinus lifts and bone regenerations, and you want to try everything. But then when you go and you have more experience, you start to see the mistakes, you start to see the problems. With digital technology, I once was there, trying everything, but I saw the errors and I saw the clinical complications that one may have if does not have the expertise to solve the problems. So my idea is that digital technology is here to stay. it's a beautiful thing. It will help you out in a lot of different protocols, but you still have to have your classic background, your classic education on implant dentistry. That's my key message for those who want to getting started with digital.
Exactly, perfect. Well, thank you very much, Andre Chen. Let's invite those who want to know much more about this to go on the EAO YouTube channel, subscribe and check out our EAO Just Asked that we had earlier this year about this topic.